Hello, my name is Julie Guidry, and I've been working with and alongside the disability community for the past 20 years, most recently leading an organization called Upstream Arts that I founded in 2006 with my husband. I'm also a parent of a 29-year-old stepson that lives with significant cognitive and developmental delays, who doesn't use words to communicate and accesses services 24/7 from support staff and direct support professionals. I also want you to know that he has every capacity to share with us his preferences and choices. He can smile and he can laugh, he can be sad and he can mourn. He can feel and he can experience this wonderful, terrible, beautiful world that we all live in. When he was 16, he was sexually assaulted by a peer at a camp, and when support staff we encountered this situation, they didn't have the tools or the knowledge to respond in a way that was clear, and they didn't have any training, and they didn't know how to prevent the incident from happening again. We'll always remember the lack of response and prevention action taken. These things can happen was the sentiment that was shared with us on that day, and although I know that these things do happen, I do not believe that they are inevitable. Upstream Arts has been an in-depth partner with more than 30 adult programs over the past 15 years around the metro, and we offer sexual violence prevention trainings for people with disabilities and the staff. And through both my personal and professional experience, I can tell you that direct support professionals are pivotal partners in prevention. They can see signs and symptoms of abuse. They can be a resource for people with disabilities who need information on what is a healthy relationship, and they can model appropriate boundaries. Moreover, direct support professionals want and need information and training on specific prevention of sexual violence, because we know that you believe in the importance and the power of this information, and that as a direct support professional, accessing these resources and tools to succeed has been difficult. On August 1st, direct support professionals are now required to receive training around healthy, balanced relationships, consent, and how to have bodily autonomy for if you are a person living with a disability. This training that is now required for all direct support professionals is going to have a significant impact, not just for my kid, but for many individuals with disabilities that receive services from a 245D licensed provider in our community. This new law is a part of a growing momentum on the part of disability advocacy organizations, on the part of service providers and trade associations that all came together to work to ensure that sexual violence, which is profoundly prevalent in our disability community, is not inevitable. It's long been the practice that providing services for people with disabilities is guided by a lens of protection rather than prevention, and the results have been devastating. People with disabilities are 7 times more likely to be sexually assaulted in their lifetime. And my experience with Upstream Arts and as a parent has compelled me to be a part of a prevention work, educating our direct support professionals about sexual violence prevention and this much needed and necessary step towards undermining the epidemic of sexual violence that is being perpetrated against our disability community. We must educate our community, we must include people with disabilities in this education, and we must provide opportunities for our direct support professionals, maybe that's you, to be a part of the disability community's education and learning. Your vision, your belief, your instinct to know that this is an essential, critical part of your learning as you train to become a direct support professional, or as you add depth to your direct support professional experience, we know and believe that you know that this is essential and important. So thank you so much for your commitment to this work.